Hi there, if you want to learn the difference between intoxication and withdrawal, then stay tuned. So, intoxication versus withdrawal. We need to understand the different presentations at a very basic level. So, generally, intoxication causes behavioral change with cerebellar signs, i.e. nystagmus, dysarthria, incoordination, gait disturbance. It causes an attentional deficit, so deficits in orientation, deficits in working memory, and the inability to count backwards. It may cause depression of the respiratory function, and it may cause coma and death. These are the general presentations of intoxication. Now, if we look specifically at certain organs, the pupils. So if we experience intoxication with opioids, we would expect pinpoint pupils. But additionally, we can expect pinpoint pupils with other hypnosedatives, for example, benzodiazepines, Z-drugs or barbiturates, procholinergics, i.e. organophosphate-based pesticides, or sympatholytics such as clonidine. And alcohol needs to cause pre-coma before it will cause pinpoint pupils. So you've really got to be incredibly intoxicated with alcohol before you get pinned with that. Then we need to think about, other manifestations of intoxication, including seizures. So seizures can be due to intoxication with tramadol, tapentadol, meperidine. These are all synthetic opioids. But of course, seizures can also be due to withdrawal from things like alcohol and other hypnosedatives such as benzodiazepines, or rarely gamma-hydroxybutyric acid, GHB. So seizures can either be due to intoxication with a substance and also from a withdrawal from a substance. And specifically with regards to alcohol, even though commonly people believe that alcohol withdrawal causes seizures, we need to also accept the fact that alcohol intoxication can also cause seizures. So just because someone's smelling of alcohol post a seizure doesn't mean that they are in withdrawal from seizure. And then we have to think about bowel signs. So reduced bowel signs is a sign of opioid intoxication, whereas increased bowel signs is a sign of opioid withdrawal. And that also fits in with the picture of diarrhea as a symptom of opioid withdrawal. Now, alcohol withdrawal also causes diarrhea and increased bowel signs. Alcohol itself can cause diarrhea, and the treatment of alcohol withdrawal, benzodiazepines, can actually calm the bowel down, and that can therefore cause constipation. So constipation can be a sign that alcohol withdrawal treatment is going well. And that doesn't mean that you don't treat the constipation, but it does mean that you're sedating the patient and you're sedating the patient's bowel sufficiently that it's not experiencing withdrawal phenomena. Now, if we look at the difference between alcohol and opioids in terms of intoxication, so opioids are more likely to cause pinpoint pupils and a reduced respiratory rate, whereas alcohol is more likely to cause early cerebellar signs, incoordination and ataxia, and of course would be positive on a breath alcohol level. That was intoxication. Now let's look at withdrawal. So the general phenomena for withdrawal include autonomic hyperarousal, so raised heart rate, blood pressure, sweating, psychiatric arousal, so insomnia, agitation, and anxiety, neurological arousal, such as tremors and seizures, and perceptual abnormalities, such as hallucinations and illusions. And if we look specifically at alcohol withdrawal, we have autonomic hyperarousal, so again, heart rate going up, blood pressure going up, sweating, neuroexcitation in the form of hyperreflexia and perceptual abnormalities and seizures, and then delirium tremens, so we've got delirium with an acute confusional state. Now compare that with opioid withdrawal. So autonomic hyperarousal again, rise in heart rate, blood pressure and sweating. But this time we also get goosebumps, and we get increased bowel signs, and we get a flu-like illness, yawning, rhinorrhea, myalgia and arthralgia. So just to summarize the differences, alcohol withdrawal tends to cause more perceptual abnormalities and seizures, whereas opioid withdrawal uniquely causes a flu-like illness. the yawning, the runny eyes, the runny nose, and the aches and pains. So this has been a very quick rundown through the difference between intoxication and withdrawal, and the difference between alcohol intoxication, alcohol withdrawal, opioid intoxication, and opioid withdrawal. That's all for today, folks. My name's Dr. Ferghal Armstrong, and this has been Cracking Addiction.